Another area in the trust where we're not seeing so many patients at the moment is our paediatric admissions. So I'm going to shortly talk to two of our paediatric service leads, one a doctor and one a nurse, to try and understand why that is, and also to give you some advice on what you should do if you have concerns about a child who's under your care. I'm now with Dr. Stephen Nermal, who's one of our consultant paediatricians. And Stephen, I gather we're not seeing as many children as we used to as well in the hospital. Do you know why that might be?
I think we are certainly seeing less children, and I think it's probably because parents are worried about COVID-19 in the hospital setting, and they are worried to bring children to hospital.
Our services are still running here as normal?
Our services are still running as usual. We are doing lots of telephone consultations. We are seeing the children in clinic if they need to be seen, and our inpatient services are running as usual.
And what would you say to a parent who's worried about their child because they're not sure whether they might have, a COVID or a viral illness, or they're worried it could be something more serious?
Yeah.
What would you tell them?
Follow the usual sort of procedure, like ringing up 111 or accessing sort of GP services. And if they advise that the child has to be seen in hospital, then they should bring children to hospital. We are open. Our wards, our A&E departments are open for children, and we want to see the children. We don't want children to be kept at home if they are very poorly.
I heard in the national press in the last week there's been some rare cases of a COVID complication in children happening. What would you say to parents who were concerned about that?
I think again, if they are concerned, they should access 111, ring up 111 and ask for the advice. And if they are asked to come to hospital, please bring the child to hospital. And we would like to examine the child and institute the necessary treatment. But I wouldn't panic unnecessarily, because I think the ones reported from London are very, very rare, and it's not. We haven't seen any child in Norfolk with those sort of extremely rare complications.
That's reassuring. Thank you.
Okay. Thank you.
So I'm now with Lisa King, who's a paediatric senior nurse at the hospital. So Lisa, can you just tell me what happens if a child arrives at our hospital, for example at our A&E, who's quite poorly? What's the pathway now?
So similar pathway. I suppose what we're thinking about now is the common symptoms of COVID-19, and those children would be separated from other children with not having those symptoms, and that's a new thing for us. But we're able to sort of separate those sort of children. The same process happens, so we'd assess the children and then admit to the children's ward if needed. We're still seeing children through A&E with the normal head injuries or traumas, and those children also need to be seen, and we need to keep both as safe as possible.
And you also see some children, I gather, who come up to quite regular, so they're children who are quite well known to you.
Yeah, definitely, and a lot of children have regular treatments that we're carrying on with, so and they can be monthly treatments or weekly treatments. So for both of those children, for all of those children that we still see is carrying on as normal.
Thank you. As you can see from the clinicians I've been talking to, it's really important that if you have any concerns about your health, you follow the usual processes and you actually contact your GP, use 111, use our direct access services if that's what you've been advised to do. But please, if you are advised to come to hospital, please do so. Thank you.